Diabetic eye disease is a group of eye problems that can affect people with diabetes. These conditions include diabetic retinopathy of different stages, diabetic macular edema, which leads to early cataract, and may be associated with glaucoma. You are not likely to have vision loss from high blood glucose in the short term. However, high glucose level can cause diabetic retinopathy, which causes leaking of the retinal blood vessels of your eyes, causing blurred vision. This temporary blurred vision usually goes away when your glucose level gets closer to normal. If your blood glucose stays high over time, it can damage the tiny blood vessels in the back of your eyes. This damage can begin during undiagnosed diabetes, when blood glucose is higher than normal. Damaged blood vessels may bleed into the middle part of the retina, causing swelling and subsequently leading to scarring. Also known as dry eye syndrome, or keratoconjunctivitis sicca, this condition is harmful and very uncomfortable for daily activities. It is characterized by a lack of fluid on and around the surface of your eye, or poor quality of tears on the front surface of the eye. Diabetes is associated to dry eyes. Dry eyes is affected by the poor function of the lacrimal gland system, which produces tears. It also affects oil glands in our eyelids that prevent the tears from evaporating and resurfacing the tear film. Tear film stability is very important, as these glands are responsible for maintaining healthy moisture levels in your eyes. The retina is the inner lining at the back of each eye, which senses light and turns it into signals that your brain decodes, so you can see the world around you. Damaged blood vessels can harm the retina, causing a disease called diabetic retinopathy. In early diabetic retinopathy or maculopathy, blood vessels can bulge or leak into the retina. This stage is called non-proliferative diabetic retinopathy. If the disease gets worse, some blood vessels close off, which causes new blood vessels to grow or proliferate on the surface of the retina. This stage is called proliferative diabetic retinopathy. Untreated diabetic retinopathy may lead to neovascular glaucoma and subsequently blindness. The part of your retina that you need for reading, seeing faces, and color vision is called the macula. Diabetes can lead to swelling in the macula, which is called diabetic macular edema. Over time, this disease can destroy the sharp vision in this part of the eye, leading to partial vision loss or blindness. Macular edema may develop in people who already have other signs of diabetic retinopathy or separately. The lenses within our eyes are clear structures that help provide sharp vision, but they tend to become cloudy with age. People with diabetes are more likely to develop cloudy lenses, called cataracts, at an earlier age than people without diabetes. Researchers think that high glucose levels cause deposits to build up in the lenses of your eyes. Glaucoma is a group of eye diseases that can damage the optic nerve, the bundle of nerves that connects the eye to the brain. Glaucoma can be associated to aging cataracts itself. Diabetes may increase the chances of having glaucoma, which can lead to irreversible vision loss and blindness if not treated early. The disease progression can be slowed down with early diagnosis. The total population of Malaysia in 2014 were 30.61 million. The prevalence of blindness in Malaysia is 1.2%, which equals to 367,000 individuals. Among the main causes are cataract 58.6%, diabetic retinopathy 10.4% and glaucoma 6.6%. However, nearly 80% of these cases can actually be treated and prevented if diagnosed earlier. To prevent diabetic eye disease, or to keep it from getting worse, manage your diabetes ABCs, your A1C, blood pressure, and cholesterol, and quit smoking if you smoke. Also, have a dilated eye exam at least once a year, or more often if recommended by your eye care professional. These actions are powerful ways to protect the health of your eyes, and can prevent blindness. Taking better care of yourself now can protect your eyes for the future. It's never too late to begin.